Hi everyone. My conceptual model for this discussion is Pender's health promotion model. I work in a med-surg setting and I see often how proactive health promotion can influence patient outcomes, especially with complex multi-diagnosis patients. This model addresses each of the four nursing meta paradigms: person, environment, health, and nursing. So, with person, in Pender's model, the person is seen as a holistic being with physical, emotional, social, and spiritual dimensions. An example in MedSurg is a post op patient recovering from a total knee arthroplasty. This isn't just a surgical wound. They have pain control needs, mobility goals, emotional adjustments, and discharge planning concerns. Recognizing them as a whole person helps us design a care plan that supports full recovery, not just wound healing. Then there's environment. Environment includes both internal and external factors that affect health behaviors. An example of this in MedSurg is hospital noise levels, frequent nighttime vitals, and limited mobility space. All these things can hinder sleep and healing. In Pender's model, we identify these barriers and adjust. For example, clustering care to allow uninterrupted rest or arranging safe ambulation paths to the room in the room. As a night shift nurse, I am a big believer of clustering a patient's care and coordinating with support staff so that patients get more uninterrupted sleep rest. Next is health. Health is defined as a positive dynamic state, not just the absence of disease. A MedSurg example of this is a patient with COPD and heart failure may never have perfect health, but through smoking cessation, education, diet changes, and pulmonary rehab referrals, we can help them improve quality of life and functional ability. The, the last meta paradigm is nursing. Nursing's role is to collaborate, educate, and encourage patients to take control of their own health. Using this as a in MedSurg as an example, when we prepare a diabetic patient for discharge, we go beyond giving insulin instructions. We also address their meal planning, their balancing activity and rest, and their blood sugar monitoring. This fits Pender's emphasis on promoting health behaviors that lead to sustained wellness. The reason Pender's health promotion model fits MedSurg practice so well is that MedSurg patients represent one of the most diverse groups in the hospital. We see everything from post-surgical recoveries to acute medical conditions repeatedly, complicated by chronic diseases and multiple comorbidities. This variety makes it critical to have a model that can be adapted to different diagnoses, stages of recovery, and patient readiness to change. Pender's health promotion model works well in this setting because it emphasizes empowering patients to take an active role in their health, not just treating the illnesses. It considers the patient's unique beliefs, identified barriers, and their motivation to adopt healthy behaviors, all factors that directly affect recovery and long-term outcomes. For example, in MedSurg, we might use this model to encourage mobility after surgery by after surgery by addressing fears, setting realistic activity goals, and showing the benefits of movement in preventing complications. Also, promote diet changes in a newly diagnosed diabetic by identifying cultural food preferences and finding acceptable alternatives, or to support heart failure patients in monitoring daily weights and recognizing early signs of fluid retention to prevent readmission. Because the model is so flexible, it can be applied across conditions, from post-op pain management to COPD breathing exercises, and it combines well with discharge teaching. This means we're not just sending patients home, we're giving them the tools and motivation to stay well, avoid complications, and improve their quality of life. I have two examples of how Pender's health promotion model can be used in med-surg practice. These examples show how the model moves from theory into real bedside strategies that help patients take control of their health, starting in the hospital and continuing at home. Number one is example Number one example is individualized self-management plans for chronic disease. The example is before discharge, we collaborate with the patient who has CHF and COPD to create a daily symptom log and oxygen use schedule. We provide short, focused teaching sessions on recognizing early warning signs like weight gain and increased shortness of breath, and incorporate the patient's own goals, such as walking to the mailbox daily. This builds confidence, improves adherence, and reduces readmission risk. Connecting Pender's model in the four meta paradigms of nursing, this strategy supports the person as an active participant in their care. It adapts to the environment they live in. It promotes optimal health through early intervention, and it guides nursing practice towards individualized, goal oriented teaching. Number two example is structured lifestyle coaching during hospital stay. The example of this is a post-op patient with obesity and hypertension might be introduced to small, realistic diet changes before discharge. Instead of a broad eat healthier advice, a dietitian or nurse team could provide a simple 3 swaps plan, such as replacing soda with water, adding a vegetable at lunch, and taking a short walk twice daily. The patient's barriers, which cost time or motivation, are addressed before discharge, and follow up with outpatient check ins can be arranged. Connecting Pender's model in the four meta paradigms of nursing, this approach allows the person to make sustainable choices, also considers the environment barriers to healthy living. It improves overall health outcomes, and it reinforces the nursing role in ongoing patient education and support. At the end of the day, med-surg is about more than treating what brought the patient in. It's about sending them out stronger, informed, and ready to manage their health. Pender's health promotion model helps us do exactly that. It's practical and adaptable, and it focuses on empowering patients to take the lead in their recovery. That's the kind of nursing that lasts far beyond the hospital stay, and that's way that's why this model fits so well with what we do every day.